This is my first summit. This is exciting. It's been such a pleasure to be here and to meet some amazing people. It's early. We're going to talk about prior authorizations. It's not the most exciting thing to talk about this early in the morning, but I actually get excited about prior authorizations. My name is Janelle Ball. I'm a biologic coordinator. I am CEO and founder of BC Educators, and I'm also a host of a podcast called That's Derm Good. The reason why I started the podcast was because I love talking about access. There's not really many people that are talking about it because it's so difficult. There's frustrations, especially in the medical office, and when it comes to getting medications approved, it's not really that easy. So one of the things that I've been doing over the last 10 years in this role has been trying to figure out the best way to help get patients access to the medications that they need as quickly as possible and with less headaches. So we're going to talk a little bit about the prior authorization and navigating insurance and a little bit of what that looks like in the office. So when you're going to your doctor's office and what to expect. So kind of setting those expectations a little bit. So first, what is a prior authorization? We're going to talk about that, what a specialty pharmacy is, and what a PBM is. In my role, I do use a lot of acronyms, so I try my best to make sure that I'm explaining a little bit. So a prior authorization is when your doctor must get that approval from the health insurance before they will cover a certain medication. And a lot of times it's required for the specialty medications like your biologics or specialty drugs. They're a little bit more expensive drugs, so insurance wants to know, do you really need this medication? If you do, show me why. So then what is a specialty pharmacy? A specialty pharmacy is the type of pharmacy that focuses on these specialty medications. So they fill these medications. And these are generally for autoimmune diseases, cancers, any rare disorders, things like that. And then a PBM. So PBM is a pharmacy benefit manager. And so this is the company that works with your insurance, and they're the ones who are the ones that are approving those prior authorizations. They're saying, we want to make sure that this is on formulary. If you want to get this medication, you might have to try this other medication first, those kind of things. So the PBM, they're the ones who work directly with the insurance company, and they're kind of managing to make sure that it's an appropriate prescription for you. So why this matters? This is important because as a patient, you want to know what questions to ask. You want to know who to talk to. You're getting the right questions. You want to make sure that the people that you are talking to are knowledgeable about the process. Also, it helps for you to be able to get your medication faster with a lot less hiccups. And then it's empowering. It allows you to be able to advocate for yourself. I'm huge on the advocating because the more you know, the better it is that you can make sure that whoever is taking care of you, that is your doctor, that is a nurse, that is an MA, that is an advocate for you, is looking out for your best interest, but you also have an idea of what's going on as well. And I always look at it as a roadmap. When you go somewhere for the first time, you're probably going to look at the map, get those directions, and go that way. You're not going to take shortcuts because you don't quite know where you're going. So it's important to know exactly what's happening and map that out first. So when it comes to the prior authorizations, there's a lot of burdens. This slide is very busy. There's a lot of information on here, but delays in treatment are very common. So 94% of physicians report that prior authorization delay access to necessary care. 94% is quite a bit. The negative impact on patient health, 33% of physicians say that PAs have led to serious adverse events for their patients in care, including hospitalization, life-threatening event, and disability or death. Patients are often left waiting. The average time for prior authorization approval is 3 to 10 business days. That is average. A lot of times it takes a lot longer. Sometimes it could be on that 3-day range, but it just depends on who's helping with that prior authorization. Also, it makes a difference for the biologics and the specialty medications as well. That can take a little bit longer. The administrative burden. So when you're in the doctor's office and you're like, how come this is taking so long for me to get this medication? There's a lot of burden on the office staff. They're spending an average of 13 hours per week per provider on prior authorizations. It's quite a bit. Biologic medications are frequently targeted, so over 80% of biologic prescriptions require a prior authorization, and often step therapy. So the insurance is saying, nope, I want to make sure that you've tried this first, and you have to have maybe 3 step therapies before you can actually get approved for this medication. And then in a patient survey, 50% or 58% said that they had never heard of a prior authorization before being told that their medication was delayed or denied. And, unfortunately, this falls on the office. Not every office is well equipped to be able to educate the patients. A lot of times when you go into the doctor's office, you're not spending a ton of time in there. It's maybe 15 minutes. That's probably generous. But time that you're spending with the doctor is not very long. So there's not a lot of time to give you that much information. At the same time, you're getting loaded with a bunch of information. By the time you leave, you've probably forgotten most of that. So, it makes a lot of sense. So one of the things that I like to educate on is talking about what to do before you go into the doctor's appointment, kind of preparing yourself for that. Definitely a list of what medications you've been on. That is huge. Whenever you go into any doctor's appointment, you want to make sure you've got a list, because that's going to boost your chances of getting whatever medication they may prescribe. Because 9 times out of 10, there are step therapy requirements, and insurance is going to want to know, especially if you change insurance companies. That doesn't always carry over. So, and sometimes insurance companies will look at it and like, well, we don't see that you've tried this. And a lot of times they look at your fill history. So they want to know, oh, well, we don't see that they've actually filled this medication, even though you said they've tried it. So it's important to bring that list and any treatments that you've tried and failed. Photos, that can be huge. If you have some photos, especially if you're going to a new doctor, bring that information in. The more information that you can provide to the doctor, the better the outcome is for you. Your insurance information. So a lot of times in the doctor's office, so for me, I've worked in multiple different roles in the office. So front office was my first role in dermatology, and I never would get the pharmacy benefit card. So that's your prescription card. And I never thought, I'm like, we don't need that. We're just seeing you for an office visit. It just bills the insurance. Well, when I started working with the biologics, I started realizing, oh, okay, we actually need that pharmacy benefit card, because that's going to make such a huge difference when it comes to me trying to do a prior authorization. So that prescription card, which is typically the one that you take to your local pharmacy. And then be prepared to discuss quality of life. Quality of life is huge. I'm seeing a lot more insurance companies asking those quality of life questions. So I think it's really important to make sure that we have all of those details to say how it affects your day-to-day, how it affects work, how it affects school, how it affects relationships. All of those things are very important. We may not think that it's important to tell the doctor, but it makes an impact. And then keeping a symptom diary, just jotting things down that you may think are not so relevant, can be very, very valuable when it comes to appealing to the insurance company. So this is a little bit of an access journey when it comes to going into the doctor's office. So the people that you might interact with, so your front office, they're going to check you in. They're going to get your demographic information, so your name, birth date, all of those, filling out all those forms, getting your insurance information. Then the medical assistant is going to take you back into the room, get some medical history, some information. That's where you can provide some of that information to your MA. And then the doctor or provider is going to come in, talk about your diagnosis, specialty medications, making all those decisions. Then you may interact with a biologic coordinator. Has anybody heard of a biologic coordinator? No? Okay. It's kind of a newer term over the last, I want to say, probably about 10 years now. But it's the person, it's the liaison in between the insurance, the patient, and the doctor's office. So what I do as a biologic coordinator, I work with my doctors. I help them, when it comes to documentation. I do a lot of education for the doctors and the MAs to make sure, hey, these are some things that insurance is looking for, and we need to make sure these are in the notes. And then I'm also working on the prior authorization on the back end and, dealing with the insurance. So I'm on the phones fighting with the insurance. It's a fight. It's sometimes it's not the greatest, and sometimes I'm not very nice to them, but some days it gets frustrating when they don't even know how to pronounce some of the medications that they're telling you that you have to try and fail. So that fight, and then I also do a lot of patient education as well. So I talk about the process. This is what it looks like when we're filling out enrollment forms or getting your history and filling with a specialty pharmacy. So all of those things. So some offices do have them. A lot of times it's just the medical assistants that are kind of doing that role and filling it. So you can imagine they're very busy with rooming patients and then trying to get on the phone. There's days where I've been on the phone with an insurance company for 45 minutes to an hour, maybe more sometimes. So that time that those MAs have is very limited. Back office phones might be calling back in to follow up to see what's the status of my prior authorization. So, it's important for all of these roles to understand what that journey looks like when it comes to accessing specialty medications. And that's what I do, a lot of that education, because believe it or not, well, I'm sure it's very believable that not a lot of offices understand that process. So before you're leaving the office, you want to confirm if you need to do any labs. Who's handling that prior authorization? Who can you reach out to kind of to hold accountable to find out, okay, what's the status? Where are we at in the process? Who do you call when I have questions? Ask for a copy of the treatment plan. What are we doing? What is the process of me getting this medication, and what happens if it gets denied? What's going to happen? So all those questions I think is very, very important. So when you're starting a biologic or a specialty medication, some of the things that you want to make sure that you are aware of before starting is getting up to date on all vaccinations before starting. Complete all labs. So if your doctor says, hey, I need you to go get these TB tests or any other labs done, you want to go and get those labs done first. A lot of insurance companies will not allow an approval unless those labs are done. Sign necessary paperwork. So there's a lot of, enrollment forms for getting started on a biologic medication. So a lot of times they need their signature on those enrollment forms. And then using a folder or notebook. I think that can be really helpful to really just kind of get all of your information, keep it all together, track your treatment plans, your goals, log your symptoms. There's a lot of resources now with a lot of the companies that have all of these things. And so this is kind of a little bit of an excerpt of the kind of sheet that I usually have for all of our offices that they give out to all patients. And then avoiding use of live vaccines while on a biologic. So these are important things that you want to talk to your doctor. If you have questions about, you want to make sure that you're talking to your doctor about that. If you have to do a vaccination, have a conversation with them. It's difficult when you kind of think, oh, you know what, I'm not supposed to do an injection or vaccine while I'm on a biologic. Let me stop my biologic. Call your doctor first. Don't even do that. Just call the doctor first. Have that conversation. They will be able to guide you in the direction. So, specialty medications versus topicals. You've got the topicals you can pick up at a specialty retail pharmacy. Specialty medications require mail order delivery through a specialty pharmacy. Topicals may or may not need a prior authorization. There's a lot of them that still do, but there's still a lot that don't really need a prior authorization. And then specialty medications, majority of the time, they always require a prior authorization. There are a few times I've experienced some insurance companies, it always just depends on the insurance company, that may or may not require a prior authorization. So what that prior authorization is your insurance's way of approving the treatment before covering it. So the ways that they are submitted typically are electronic prior authorizations. So typically I'm using it's called Cover My Meds, and that's where I usually go to submit this prior authorization. They can be done over the phone, they can be done by fax, and some of these specialty pharmacies, they offer additional services and support where they can do that prior authorization as well. So biggest thing that I always try to explain to offices is the more information, the better, right? The more details in those chart notes. So if you're looking at how it affects you, what medications you've tried and failed, some of the scoring tools and things that they might use. Yesterday we heard about the Hurley stage. Those are information that should be in those chart notes in order to get an approval, because insurance companies are asking for that. These PAs typically can be approved within 24 to 48 hours. Usually the electronic prior authorizations are the fastest, sometimes the phone ones, but again, it's all based on the insurance company. A lot of times they, whatever plans that you have, they change. They decide how long it's going to take. One of the things that I always tell offices to do is mark it urgent. These things, I don't like to wait. I'm very, very impatient when it comes to prior authorizations and the process. And so I always mark everything urgent, and I try to make sure that I'm getting stuff done as quickly as possible. Because the prior authorization part may take 24 to 48 hours, but it's the actual getting the medication from the specialty pharmacy. Because once it's approved, then it has to go to the pharmacy. The pharmacy has to recheck those benefits just to make sure that it's been approved, and then they're going to say, okay, now we can put it in queue to get shipped out to the patient. So that can take a little bit of time. That's where that 10 days or 15 days sometimes can take. So when you can imagine an office that has just a medical assistant that's working on this prior authorization, it's going to take a lot longer because their priority is rooming the patients for the doctors. So that process can take a lot longer. So dealing with denials and appeals. So this is not fun. But common reasons why things get denied is because of missing documentation. That's probably the number one thing that I see in offices: missing documentation or missing step therapy. So insurance companies, they don't tell you, hey, you're gonna have to try this, this, and this before you get prescribed this other medication, right? They don't tell you that. We find out a lot of times, unless I've dealt with the insurance company, and I'm pretty familiar with a lot of these, so I know, but most offices don't know that. They don't understand what medications are going to be asked for them, for the patient to try first. So step therapy requirements. There's some doctors that I talk to that they are like, I don't care, this is what they need, and this is what we're going to get. So, that's how it works sometimes, but you might see those denials based on step therapy requirements or just some missing information. So what happens next? You can do an appeal, or there's a peer-to-peer, and then letters from the provider or the patient. Biggest thing is to keep that communication open. When it comes to the appeals process, that can take a little bit of time. So I like to educate the office and let them know that, when you're submitting an appeal on behalf of the patient, this is a legal document that is on behalf of coming from the doctor, so they're really writing on behalf of you, and so it's important to have all the details. It's important to have as much quality of life information, the impact, the reason, the clinical data as to why they want this medication over what the insurance is preferring. So it's really important to be as detailed as possible in those appeals. You as a patient can appeal as well. And a lot of times insurance companies can listen to you a little bit more than they listen to the doctor's office. It's unfortunate, but that's just how it happens sometimes. So when that does happen, one thing I would say is a lot of times you might get an appeal letter in your mail, or you might get something sent to you that says that your prescription has been denied. One of the things I would say is look at the reason why it was denied first. Figure out why they're telling you it's denied. A lot of times it's in that very first paragraph. It'll tell you, whether it's we didn't get enough information from your doctor, or, you didn't try and fail medication. They try to scare you and say, if you get this medication, you're going to be paying a lot of money out of pocket. Disregard that. Don't even pay attention to that. We get those same letters. I always say, it's a hurdle. It's not the end. It's just a little hurdle that we might have to jump through. And when it comes to a lot of the manufacturer companies, they have bridge programs. They have things that are available if you have a commercial insurance. So the bridge programs provide temporary access. And this is at low cost or no cost. You can get free drug if your prior authorization is delayed or denied. And so I would encourage you to talk to the office, say, hey, what is available because we got this denial? What's the next step? If there is an approval and you have a commercial insurance, then they do offer a lot of these copay savings cards. And the copay savings card will lower your cost. So when you go to the specialty pharmacy, you'll get this little card. And a lot of times what will happen is you want to take that information and have it on hand. And when you're ordering your prescription or setting up that delivery, you have that information to give to them to say, hey, I need you to apply this copay savings card. And a lot of times they don't automatically apply those. The specialty pharmacies, they don't try to save you any money, unfortunately. So when you're getting that information and you're setting it up, it's important to know, what is the cost of my medication? How much is this going to cost before it gets shipped out? Because if you get something shipped out and you don't know, sometimes they might send you a bill, and we don't want that to happen. So I would always say, if you don't know, you call your pharmacy and they tell you, oh, your prescription is going to be $400. Nope. Call your doctor's office. Find out why it's going to be that expensive. Because most of the time you should have a $0 copay or a $5 copay for a lot of these medications if you have a commercial insurance. Patient assistance programs would be for Medicare, Medicaid, any government-funded plans, or if you don't have insurance at all. So most of the time, these are income-based. So you can apply for these patient assistance programs through the manufacturer. So I know like all the companies outside that are here today, like Novartis, UCB, Insight, they all have these patient assistance programs that you can apply for. So the specialty pharmacies, they're going to fill the medication. Some insurances require you to fill by their mandated specialty pharmacies, which is also fun. I'm telling you guys, it's a great thing working in the insurance space. But so a lot of times what will happen is the insurance companies will say, okay, now we've approved this medication, you also need to fill at one of our pharmacies. And so it's important to know where your medication is coming from. So a lot of times there can be some confusion when you're working with some of these specialty pharmacies and when you're working with the manufacturer. So if you know you've got a denial for your prior authorization, then most of the time communicate with your office, make sure you know where your medication is coming from. If you're getting enrolled into a bridge program, then you need to make sure you know what pharmacy it's coming from, because it's different than your pharmacy that your insurance has approved it through. So does that make sense? So definitely communicating with the office is going to make it a little bit easier. So patient support, this is huge. Again, it could be a biologic coordinator, the office medical assistant, the nurse in the office. Some of the physician assistants are really good with this, but they're the ones who are going to be able to, kind of handle the prior authorization, the paperwork, education. There's also a lot of nursing support through the manufacturers. And when you sign that enrollment form, that's giving consent to allow them to reach out to you, and that provides a lot of support. They can usually have like a nurse that can talk to you about their programs and what they offer. And I think those are really valuable because you can get set up with their copay card. You can get a Sharps container sent to you for free. You can have injection training for free. You can, just have somebody else that is an outside advocate. So, and I like it because you've got, your doctor's office, they're helping, making sure that you're getting prescribed a medication and all of that. But when you are prescribed a medication, and they come in, they're saying, hey, this is the medication for you, this is what we're gonna get you started on. Well, that company has a nurse and has support to be able to guide you through that process for that specific medication. So they're going to be focused on that medication and be able to kind of guide you and help you understand the process and any hiccups, things that happen, because there's always something that comes up, whether it's a copay card issue or, insurance problems, things like that. They're going to be able to kind of be that additional person and support. They're not there to give you any medical advice. They're really there just to kind of help guide you through the process of getting on that medication. So we kind of just talked about what the manufacturer, I'm getting ahead of myself, but they offer that injection training, shipping support. So they'll ship out Sharps containers directly to you. A lot of times you'll get that filled up and you can send it back to them at no cost. But when you do get enrolled, and that's what that enrollment form is. So I always like to, make sure that that form is signed before you leave the office. A lot of times, if you don't sign it, or maybe it's a virtual appointment, you can call the manufacturer and get that support. But they're there to really help you get on that medication and know that your cost is going to be a lot lower than the out-of-pocket that your specialty pharmacy might offer. So summary and takeaway, really being your own advocate, knowing who to talk to, asking clear questions to make sure that you're getting your questions answered, writing those down. Like for me, I get migraines, and whenever I go to the doctor's office, I don't always remember what questions I was supposed to ask, or if I don't write them down, if I'm like, oh no, that sounds like a dumb question, I don't think I want to ask them that, and then I leave the office and I'm like, man, I really should have asked that question. So write those questions down, ask those questions, that's what they're there for. Get as much information as you can. Utilize your care team, utilize the resources that are there and are able to provide you that support. Take advantage of those support programs. Biggest thing is, knowing that they have these bridge programs, if you have your commercial insurance, that you can get free drug, that they have ways to get your medication and get that support. And if it's approved through your insurance, most of the time you're gonna have a $5 copay or a $0 copay. So it's really important to make sure you're utilizing that support. So if we have any questions, yes. Yeah. So, and this happens a lot. A lot of times, if you have been on a medication for a while, then all of a sudden your insurance denies it. It could be because of formulary changes, but it also could be because the documentation. A lot of times, that's the thing I always look at, why it was denied first. Figuring out that is your number one thing. But when that happens, a lot of times it's because the documentation hasn't been done. So when you come in for an appointment, you get an approval. A lot of times that approval time is 12 months. Sometimes it's been shorter recently, just with some of the insurances, but usually they give you a 12-month approval. Well, if you don't come in before that approval ends, then they're not going to be able to approve that next follow-up, that next prescription or prior authorization. So what I always say is come back in for those follow-up appointments. We want the doctors to document how well they've improved, why it's important for them to stay on the medication. And one of the things that I like to tell them is including that quality of life again, because that's going to make a huge difference when it comes to, you've been established on a therapy for a while. The last thing you want to do is switch to a different therapy. If it's not working, then why are we changing medication? So it's important to make sure that the doctor's office is documenting how well you're improving, and we're showing that information because we have to send that into the insurance companies. And so when the insurance company sees that, then they're going to understand. And I always tell offices, I'm like, you've got to put the liability on the insurance company, because if anything were to happen, there can be an adverse reaction. If you were to switch a medication and you've been doing great this whole time and it's been working, and then you switch to a different medication because the insurance is telling you it's not on formulary, that's not always the best thing. So it's important to come in for those follow-ups, number one, because you want to make sure that we're documenting well and we're getting that information to the insurance company so they know how much it's improved and how well it's working. Yes? Yes?
I've got a lot to say about this. We can jump through some hoops, and we're going to have to save that for the podcast, I think. But trying to keep my blood from boiling. Is there some kind of rule or law where if you appeal and elevate, and still finally end up getting denied, that they can't tell you who's denying you? Because I was asking my patient coordinator, manager, or whoever, I said, so who is this, the PA manager that is denying me? Who is this person? And she would not give me a name at all.
At the insurance company?
Yeah.
Yeah, I don't know if sometimes it's a pharmacist. So one of the things that I do whenever I write appeals, number one, I mark it urgent. I always request a dermatologist to review because I want a match specialist to review all of my appeals. The office can request that, and they have to send them a dermatologist. The other thing is for peer-to-peer reviews, a lot of times they're speaking with another physician that's on their board. So it could be that. A lot of times it's the pharmacist within the company, the insurance company, that is doing those reviews and denying those appeals. A lot of times it's, it's either because it's not on formulary or they just don't have enough information to, really compel them to approve it.
We had a 95-page document, extremely detailed about everything that I've gone through. And I mean, it elevated from this manager to the next manager to the regional manager, appeals. We went through all that process just
Yeah.
to say they're still denying it. And I was like, well, okay, who is denying it? Let me know so I
Right.
can talk to them. They would not.
Yeah, I don't know if there is a legal thing, obligation for them to say that, I mean, it's insurance companies, so unfortunately, that stuff does happen. Thankfully, this is why we have these patient assistance foundations and the support through the companies and manufacturers. They try their hardest, they really do, to make sure that you're able to get the medication. So if that ever happens, I would say, follow up with, ask the company. If you're set up with, the nurse support or the guides that are at some of these companies, ask them, hey, what can we do because my insurance is not covering this?
So this wasn't a medicine though. This was,
Oh, okay.
I was accepted into the HS clinic at the Mayo Clinic, like right up the road from my house, and it's not in network, and that was the problem. And I'm
Okay.
trying to get in there rather than see run-of-the-mill dermatologist who doesn't know what they're talking about, which I had to go
Yeah.
through. So that's what it wasn't an actual
Okay.
medication. So I don't know the rules on that, but
Yeah. That I don't know. That's a difficult one. Yes.
So kind of a follow-on is a patient allowed to see what the prior auth looks like before it's submitted? Because if we're not lucky enough to have biologic coordinators like you, I fear that in the day-to-day, everything going so fast, paperwork is submitted with the bare minimum just to get it done. It doesn't properly represent the entire story. So
Yeah.
can we as patients?
I think you can call the insurance company and try that on your behalf, absolutely. I've never had a patient ask if they could see the prior authorization. But, I mean, I think that's definitely worth asking. You can definitely ask the doctor's office, say, hey, what are some of those questions that they're asking? What can I do to help support this? And a lot of times you can submit a letter to the insurance company. I always tell offices, add some quotes in there. Ask the patient questions and get some information from the patient and put that information in those prior authorizations.
Thank you.
Yes.
I have a question, because I know that sometimes patients are mandated to try a drug by their insurance company that is off-label. So how would you address that with a prior authorization form and the doctor's office communicating with the insurance company?
Yeah, so really a lot of that is, putting that information in the appeal, number one. Also clinical data, so if there's clinical trials, the FDA, the packet insert, a lot of times I suggest sending that in and highlighting that information. And the other thing is, I tell the insurance company, you're going to be held liable if anything were to happen to this patient because you're requesting this medication that is not on label. I saw that recently with somebody talking about some of the biosimilars that are coming out, and the insurance companies are wanting, like with Humira, there's a lot of these, they're not generics, they're called biosimilars. They're very similar, but they can't be the exact same thing. So I've seen that where there's some insurance companies that are requesting some of these biosimilars and they're not on label or they're not FDA approved for the patient. So I've heard of that, and it is very, very frustrating. So again, it's just that battle that we have to fight and try to make sure that we're getting as much information, those clinical trials, the data, the package insert, specifically from the actual drug company. I think that makes a huge impact. But, again, that's where we have to unfortunately utilize some of those patient assistance programs and the bridge programs.